The reason I would like to nominate Victoria is because she goes above and beyond, not only for her clients, but also for her colleagues. Ever the professional, comes to work with a big smile and her cup of tea. She sees clients sometimes before work hours to make sure that they can get the services that they need and maintain their jobs. Sometimes she has seen clients after work hours to make sure that they get the services that they need.
Taking on a new leadership role is hard at the best of times, but taking on a leadership role during what has turned out to be the biggest healthcare crisis of our time is not only brave, but a demonstration of Dr. Fioco's commitment to BGH, his colleagues, and the community we serve.
Emily demonstrates the values of BGH by showing compassion, respect, and professionalism to everyone she encounters. She is the very definition of teamwork, and we are extremely lucky to have her. On a more personal level, I'd like to share how Emily made sure to check on the ICU staff during this difficult time to make sure that we were doing okay. I know there were several times when the stress of COVID and trying to update families at a distance were weighing heavy on me. And a friendly check-in with Emily, and she would listen and support me and encourage me and turn the conversation around, and we'd be laughing, and I knew I wasn't in this alone and that we were going to get through this.
I'd like to recognize Dave Milan, our Director of Facilities, for all of his incredible work that led to the opening of the Donald B. Green Tower. Certainly this being an infrastructure project, Dave had a lot of time and energy and passion invested into the project. From a security perspective, he made sure that both patients and staff were safe. He and his team worked around the clock for what feels like a very long time to make sure that things got up and running, especially during the very middle of the COVID-19 pandemic.
When there is an urgent matter or an add-on exercise stress test or a patient to be seen, he often takes the responsibility of handling these urgent cases to provide excellent patient care. There have been numerous times one of us in the cardiovascular department have come across an abnormal test, whether it be his patient or not, and it requires immediate attention. He takes action and happily gets the patient the care they need or offer a referral or other test arrangements made.
Kim represents, to me, vision of this hospital. She's compassionate, she's respectful to others, she's a team player. I've been on the crisis team now for a couple years, and new adventure. My first time going to the emergency department, I was very, very nervous. I was greeted by Kim, who was in charge, and she greeted with me with a smile, and that just eased my discomfort right away.
Throughout the past 1+ years, Abby has gone above and beyond her role at BGH by providing us, the nervous staff members, with updates constantly, including on her time off. She has also been providing updates and education to our community through not only the use of BGH on social media, but also on pages set up for community members trying to stay on top of the pandemic. Anyone who meets Abby instantly falls in love with her, as her smile and her general presentation exude compassion.
I hear that they're looking for a nomination for the What Team Member of the Year. And I thought to myself, who would be a better nominee than Dr. Kevin Varley?
We nominate Dr. Varley! We nominate Dr. Varley!
He promotes a positive, respectful environment and civility in the workplace. I know that you can ask any team in the hospital, whether it's the ER, the ICU, how about the inpatient service, or the med-surg units. They all appreciate Dr. Varley's kind, compassionate work, his responsiveness to their needs and the patient's needs, and making them feel important.
We all know Liz is the coordinator of our wonderful volunteers, but during the pandemic, her teamwork and professionalism shone as she became known for so many other roles that she just jumped into and helped without hesitation whenever it was needed, with a smile, because, well, that's Liz.
When the pandemic first hit, Liz was a huge help to the marketing communications team. There was so much information that our staff and physicians need to know about COVID, and Liz was instrumental in helping to design and put up so many COVID-related information posters.
In March of this year, our hospital worked hard to try and bring patients and families together amid so many restrictions. We began providing virtual visits for patients and families so they could connect. Liz jumped in and supported this process, and we were able to connect so many patients with their families.
Jocelyn always goes above and beyond for her patients. She helps out the team. A good example of Jocelyn's compassion is we have a patient on palliative care who is approaching end of life, and he had a few bucket list items that he wished to complete. So Jocelyn took it upon herself to help make sure those things happened. So things like bringing in a Tim's coffee for him to enjoy in the morning.
In addition to being very patient-centered, she's also a wonderful team member to have. We're always very excited when she comes in on shift. She's always super eager to help everyone around her.
We've been able to expand the department. We've been able to provide a lot better service in evenings and weekends for the hospital and the community, and it's all been a lot of her working on our side to get the funding and help us through the business aspects of things. And I feel it's rare the level of teamwork that I have with Linda and our whole area of the hospital. And I've talked to many physicians and other community members who feel the same way about her, especially in our hospital. So nominating her for Team Member of the Year is a slam dunk for me.
We think that more than anyone, Deanne deserves this nomination. She exemplifies BGH's core values of compassion, respect, accountability, professionalism, and teamwork. Compassionate leaders immerse themselves in the daily grind with their team, helping them face and solve challenges or overcome barriers.
When I first started, specifically cardiac rehab and outpatient mental health, there was some inconsistencies with the way our roles were established in both of those areas. In mental health specifically, she helped me establish referral processes.
The work we do in ACU was foreign to Deanne at first, as our unit is unlike any other at the BGH. But Deanne has worked hard to understand the incredible service we provide to our community. She has become an essential resource and leader to our team.
With us screeners, Deanne has consistently displayed accountability, teamwork, and respect. As a screener, every day is unique. Deanne has shown that she is open, educating, and welcoming to questions and information. She has always been transparent with policy changes and supportive of her staff, which in turn gives us the confidence to effectively communicate with and direct the public.
I call her the fixer because Deanne fixes everything. She's quick, and whenever we have an issue, she solves it.